Welcome to today's Cincy Spotlight featuring Excelin Home Health. We will discuss how Excelin uses telehealth and virtual care to deliver patient care during the pandemic. In our exclusive conversation with Alicia, the CEO of Excelin, and Misty, Director of Patient Care Services at Excelin and Regional Vice President of Patient Care Services for Advanced Home Health Services, they'll share how they use virtual care amid the pandemic and how we work with Excelin Home Health. Topics for today are how Excelin has been delivering patient care amid COVID. What is the role of telehealth in that regard, whether it's with COVID patients or non-COVID patients, and what are some specific use cases? And what's important to everyone is, of course, the results. What is the impact in terms of satisfaction, adherence, and outcomes related to patient, family, and clinicians within Excelin and Advanced Home Health Services? And lastly, there will be some closing remarks from our panelists, and we will address any remaining questions at that time. So let's get right into it. Misty and Alicia, very excited. We had an opportunity to really discuss, goals, the way it's transformed care and personalizing compassion that aligns directly with Excelin Home Health and some of those keys to success. So to start out, what I'd like to do is I'd like to open it up here by way of a conversation here and talk to me a little bit more about Excelin Home Health and how exactly you guys are transforming care.
Thank you, Edward. So Excelin was formed about 3 years ago as a culmination of some acquisition opportunities starting in 2017 and in 2018. Currently, we have 14 different care sites throughout Texas and California, providing home health, hospice, and a small private duty service line in 2 different states. And those are pretty widespread in both rural and metro markets. We're pretty diverse in both some chronic care management and then acute care in orthopedic and rehab. And we really try to be forward thinking in our technology spectrum, with trying to service such a broad range of patient care in taking care of such a high acute care population, even with IVs and such that, we really have to depend very heavily on technology and being forward thinking on that space. So, we're very interested in those spaces that support that, especially if it supports our EMR and how we can move forward with that. And so we've always been interested in that.
Great. So one of the things I know we had discussed is, being in multiple states and having the multiple communication modalities, how critically important that is to be able to reach across, multiple geographies, as well as, following the patient, throughout that transition of care. So I do see that, obviously supporting the employees so they can deliver, the industry best care. I know you use a lot of internal messaging as well as it relates to your clinicians, and we'll talk more about, those efficiencies and what it's meant crossing those barriers geographically. So thank you for that. And in speaking of keys to success, so you were clearly at Excelin a standout client of ours, have found multiple successes in a variety of communication modalities with the Cincy platform. So let's talk more about that. So with those keys to success, I'll let you talk a little bit more here about, how you developed that implementation plan and how critical that was to this implementation.
Sure. So I started with Excelin in November of 2019 and really brought previous history with Cincy to the company. And so we already had a vision to adopt some sort of telehealth platform in joining the organization, really in an effort to be very forward thinking about how we build out a care plan model that incorporates telehealth as we thought about PDGM or centralized intake functions or triage. And so we really always had telehealth in our vision of our care model. I would tell you that as COVID was introduced, no one could predict that. So to already have that relationship with Cincy and to be able to kind of partner with them to say, okay, how can we fast track this? How can we better serve our patients and be able to keep our employees safe? And be able to go to the table with Cincy in real time and execute that in quick order, literally in days, for our staff was just a phenomenal opportunity for us to be able to do that. So it was really in a space that we really didn't think of initially, but to be able to execute that in such short order in a way of emergency planning, and to be able to put great safeguards on our patients, to not alert to our patients and to our staff, and to be able to track and trend that was just an amazing opportunity for our agency. I will tell you on the backside of that, we are, 8 months, 9 months into COVID, and we have a 0 employee to patient infection rate. We've gone through a couple of state surveys with a focus on infection, and I'll let Misty kind of speak on that because those have been her agencies, and we've utilized Cincy's platform on that. But I tell you, we've leaned heavily on this technology to help us to have such a successful infection rating and to keep our staff and our patients safe through this process. It was just really kind of an amazing opportunity through this entire process, a win that we've really kind of recognized through a pandemic, truly.
That's fantastic. Yeah. So Misty, if you could talk more about the 0 infection rate, love to hear more of the details on that. And obviously it's a staggering statistic, and I'm sure others would love to benefit from hearing the way you came about that with utilization of technology as one of the components.
Well, good morning. And yes, we were very lucky that Alicia brought this to us. And little did we know where we'd get to explode with Cincy. This has been very fun to develop with you guys, and it's just been very satisfying. We've really done good things with it. We underwent many people have not undergone an infection control survey. We did go through an infection control survey before we even went through our regular certifications. So what we were able to prove and show is the way that we are able to track our clinicians on a daily basis to ensure that we are following all of the needed questions that are required so that our staff are safe to see patients on a daily basis. So we've been able to do it that way. And we've been able to communicate through Cincy. So we've been able to use it for the return to work assessments. We've been able to use it for our patient messaging, our staff messaging, and also through some survey questions that we've needed to ask our employees. So we've really been able to communicate in a different way. And that really has helped our infection control, is being able to stay on top of it. Before any of our clinicians see a patient each morning, we have the ability to send them that message to ensure that they are safe to see them on a daily basis. And that's one of the things that we've been able to do. We were able to show in that infection control survey how we do this, how the information is stored, and that it's easily accessible, and it's very clean and very well put together for that surveyor. So they were very satisfied by using this technology.
Thank you for that, Misty. And speaking of going back a little bit to return to work, for those less familiar with return to work, talk a little bit about what the adoption looked like from a clinician's perspective. One of the things obviously that we hear is that adoption is critically important in the beginning stages, and relaying appropriately on a rollout process to clinical staff is of the utmost importance as well. How were they able to adopt so quickly? And how was it that you drove that reinforcement of the return to work assessment and such high adoption of it?
Well, one thing I want to say about that before I start the real process is Cincy has done an incredible job of providing us a weekly meeting for us to make sure that all of our implementation was done flawlessly. I have had a wonderful staff partner. Rolando has just been a champion for me to be able to help us in Cincy come up with ideas of things that is going to help us to be successful. And we were discussing the situations that we had been under, and our branch clinical managers on a daily basis were having to track this data and see actual pictures of thermometers to make sure that our staff were safe to see our patients. So Cindy had developed a wonderful way, it's called a return to work assessment, and developed that plan so that every day that questionnaire is asked for all the appropriate questions for CDC, and it goes out at 7 o'clock every morning to every one of our clinical staff that's going to see our patients. And it would flag one of our managers if somebody answered one of the questions inappropriately that made them unsafe to see that patient. So, I mean, we just can't thank you guys enough, because it has just the amount of time that our managers were taking to have to pull schedules on a daily basis and document that information. This is just such a clean way with your reporting. You know, you have all of your reporting is encapsulated in here, so we can go pull every single day any information that is needed to show each clinician that they were cleared on their temperature and all of the appropriate questions for if they've had any symptoms or if they've been in contact with anybody. So it has made the success time much faster for our managers. It is the documentation is just very clean and very orderly, and it is allowing them to move on with their day instead of spending so much time each morning trying to prepare and gather that data. It was a big game changer for us.
And like, it's more accurate to the information, you know, because we can keep it concise and be able to track and trend it for compliance.
Yeah, tracking trend. Now, speaking of reporting, you bring up a great point to accurately report, Alicia. So in the reporting functionality, I know we have, you know, real-time reporting functions and the ability to pull that real time. Are you guys pulling that on a daily basis? Are you pulling it hourly throughout the day? What does that look like by way of kind of an internal protocol that you found the most success with the return to work assessment?
They pull it every morning before the clinicians go out to actually see the patients, to ensure that there is not anybody who needs to have additional questions to ask or anything like that. So it is definitely on a daily basis that they pull that data.
Okay, thank you for that. Perfect. So in looking at, you know, future thoughts on, you know, return to work, obviously COVID has changed the landscape of the delivery of care. And as I mentioned, it coincides directly, you know, with Excelin and your mission. Having said that, what do you foresee moving forward, you know, as we near and knock on the door here to 2021, as I'm looking at a map? What do you foresee as really the biggest game changers, and what the residual effects are going to be of examples, return to work or other assessments or components of virtual care?
You know, there's an unlimited amount. So, you know, definitely on, you know, the staffing level, the return to work assessment could be modified for an unlimited amount of other assessments that you could incorporate either internally for your own process within your organization, or aside from that. So for example, I mean, just if we could even turn this assessment now that COVID-19 vaccine is available, to do an assessment of determining when they got the vaccine and be able to track and train our employees of when they got the vaccine, and then be able to record that internally within our records that we have locally within our agency. We could, you know, modify that with other renewable activities that we require our employees to be able to do. We could redo these assessments with any type of teaching and training that we need to do spontaneously, as we have other emergency preparedness activities. I mean, so I think it can go on and on, our ability to utilize this return to work, or our random educational response items that you need to get from the employees. I mean, I think that we've been able to kind of appreciate and understand the ability to cast out some sort of a message or survey to the employees and get some sort of an immediate response, and track and trend that information and be able to reproduce that in some sort of report fashion. And that's really what we're trying to look for, really, right? From a
Exactly.
clinical standpoint, I think it's been very well said. The industry and our state and federal agencies have done a phenomenal job, along with our acute care partners, of demonstrating that telehealth is very forward thinking. We've been able to demonstrate that we've been able to still take care of our patients safely and effectively at a much reduced cost. And I think that many of the payers are doing a phenomenal job of doing some reimbursement of that with the physician levels, the acute care, and the post-acute care partners. You know, there is an act, a bipartisan act, the HEAT Act, is up for discussion right now about getting some reimbursement on the home health front, and I'm very excited about that. I'm a huge champion of that. We actually did some internal promotion of that within our own agency just recently. I encourage anyone who's joining this call to definitely be putting their steps forward on promoting telehealth within their agency by incorporating that into their plan of care and start moving those steps forward. But I don't know that, you know, outside of the PHE period, that they're gonna have provisions for a platform that's not going to be HIPAA compliant. So, you know, the days of FaceTime or TikTok, or however you're going to be able to use some sort of a virtual care platform, is going to be acceptable. I think if there's going to be any type of reimbursement, they're going to be looking for some sort of like a compliant platform. But definitely, if we're going to go into an ACO or a pay for performance model, you have to be thinking about telehealth, because it's all about how do you improve patient care at a reduced cost? How do you secure your outcome but not, you know, break the bank in delivering that care? And so telehealth is really kind of that bridge to kind of get you there. And we proved it out in the middle of a pandemic. We proved it.
That's right. And when you think about how it continues, how virtual care really continues to play, you know, one of the most critical roles in the delivery of healthcare, you know, during this virus outbreak. So having said that, you mentioned the HEAT Act, and I know one of the really unique things you did from the start was to really push out information as it relates to the HEAT Act and really get your clinicians involved. Talk to me about what you sent out and how you got them actively participating in kind of the change and the effect that they can have by reaching out individually, even with the HEAT Act.
So, you know, National Association of Home Care, you know, and, you know, other supporters were certainly wanting to promote support of the HEAT Act. And we, you know, are members of that. So, you know, creating awareness is so critical to promotion of these types of initiatives. And so we took ownership of that individually, and we casted that out by use of Cincy to every one of our employees of the company, and basically copied and pasted their message and encouraged them to contact their local congressman with support of the HEAT Act. And really what we did was drive some sort of initiative, and with that, if they contacted their congressman either by phone or email and demonstrated, we had them, you know, snap a picture of that, and they actually are registered in a drawing. We're going to give out some sort of a gift card drawing for them, just to demonstrate, you know, improvement of their commitment to what support of their industry truly for that. And it creates awareness. We gave them the background story about what it was, and, you know, it's truly 2 clicks of a button or 1 phone call. And so it wasn't very labor intensive on their part, and it was an ability for us to use the platform, you know, to generate the awareness. So it was kind of a double win for us to be able to do that. And so, you know, I think we got a great response. Misty, I don't know, how many people did we have total? I mean, we're about to do the drawing this week for those.
I believe that we are a little about 115, 120 that did go in and complete the survey and said that, you know, not only did they receive the message, but they did act on the message. So they had the ability just to respond that, you know, they got it, and then they had the ability to say yes and what they did with it. And so I think there's about 120 that are going to be in that drawing.
Yeah.
Yeah. Right. So, well, we won't ask you to do a live drawing
That's
of
just
that.
on the Texas side, sorry.
Yeah.
Yeah. Now, but kudos to the creative distribution and the utilization of the platform in a creative way, right? And that's what this is about. Is there are numerous. I mean, we couldn't even take it up on this hour. Ways in which we've heard different clients who have been successful, just like Excelin, utilizing the platform. And that's just another way internally to be able to really drive that adoption. That coincides with, your most critical partners, national partners like that. And in speaking of partnerships, so how are you sharing data with referral partners such as, the patient's physicians?
Misty, do you want to take that on the physician side?
Sure. So one of y'all's newest tools that we've been able to utilize is some of the remote vitals monitoring. And so because of the fact that we are able to implement and use the Bluetooth type of equipment and able to use that, we're able to share the reporting data that you guys have developed with our actual physicians who are monitoring and taking care of those patients. So we've done it in multiple different ways, but the remote vitals monitoring really has been a tool that we're building on right now to be able to share that very vital information about that patient and where they stand by sharing the vital signs on like a weekly basis. Some of them are wanting it more often. It's really helping with these COVID patients to be able to monitor the oxygen levels and being able to monitor those very basic vital signs. The CHF patients and being able to monitor weights and get that information to them. And then, the newest part with the glucometer monitoring for those diabetic patients. So there's several different tools that is actual patient-driven data to provide to our referral sources, and they really like patient-driven data. So that's been the second part of everything of what we've been developing and learning to use through Cindy.
Yeah, so that sounds to me like the really kind of the second pillar, if you will. Now that the adoption is throughout Excelin, as you mentioned, just for those who aren't as familiar on the webinar today, the blood pressure, the pulse ox, heart rate, temp, weight. When we talk about a lot of that basic information and how critical that is by way of a component that you want to monitor daily, if not hourly. These Bluetooth devices that are enabled really sync seamlessly with the Sensi platform. So having said that, we get a lot of questions as it relates to the RPM initiative and what we've done, obviously as an answer to our clients' requests. So as a follow-up to the adoption of RPM, is there any critical piece or practical advice you'd give to an organization who's looking at that type of technology?
Well, I think to realize the technology you guys have, that you guys have developed in a way to be able to financially preserve, not having to sign on to a big contract with a company that you have to buy thousands of dollars worth of equipment and sign into these big contracts. You guys have set up a way that we can actually do it on a case-by-case basis. We don't have to go out and buy just loads of equipment to get to be able to provide this. And again, it's very direct. If it's a COVID patient, we don't need a scale. Many of those programs that you get into, you have to buy the whole package. And this is on a case-by-case, we can build what each patient needs and what each physician wants to see for that patient. So financially, this has been a really smart way to be able to customize what that patient and what that physician wants it to look like.
Great. Thank you for that. So maybe a larger mountain than it needs to be to climb. With the utilization of the Sensi platform, we aimed to make it a seamless integration and really built into one robust communication form. So it is nice to hear that a client like you guys have not just chosen to adopt, but also been so seamless in that. I want to say it was probably no less than 45 to 60 days from the time that you guys wanted to adopt that. You guys went out and searched for it. Sometimes we do make recommendations as it relates to different sites to ensure they are Bluetooth enabled. But you guys really took that and ran with it. And so what I'd like the folks on the call today to hear is that it was very seamless, and it didn't require a whole lot of additional effort aside for just logging into the platform as you would do on a normal basis and monitoring.
Correct. It's been a very easy process. It's very user friendly, and like I said, you guys have really helped us. Cindy has really just helped us develop it, and I kept asking from the get-go, it's okay, even if we're not completely done, let's get in there. And it's been a very easy transition. The data is very easy to follow. The reporting is easy to be able to get to the physician. So far it's been great, and we're just looking forward to getting even more patients involved. And again, it's a customization. It's not all or nothing. You can do what that patient needs. So you're not wasting those financial dollars and big packages of things that are not necessarily needed.
And the nice thing too about
Alicia.
Oh, I'm sorry. Then I was just going to say the nice thing about the RPM for our agency is, as we're working with different payer sources, you're wanting to capture those data points that happen in between our patient care visits. And so especially if you're trying to get approval for additional care visits or recertification. And so to be able to have those data points available and be able to produce that to the payer source, if it's a Medicare or insurance company, and justify that they're still having some sort of exacerbation within their disease process, that's powerful information. It's good data. It's not an opinion. And so I think that that's great information to be able to produce to them.
Absolutely.
Yeah, and so that is a perfect segue into how you guys have adopted and utilized the platform and kind of the different components of Cindy. So kind of taking that there as a perfect segue into a company that's focused on healthcare. I think without even having to state that, I think it's a little obvious that we do work alongside as a direct partner. And so one of the things I do enjoy hearing is, as you guys have stated multiple times, is that we work with you to, obviously help to enhance and really get in and strategize as it relates to the workflow and adoption. However, one of the things before I jump into a couple of these is having an internal champion. And I think I'd be remiss to not call out and thank you guys as well, being the partners that you are. Because adoption is so critically reliant upon internal telehealth champion. As I hear, Alicia, you and Misty really walk through with the enthusiasm that you do and having the success that you've had. What would you say as far as the best practice in, really scaling the use of this telehealth initiative and really, what it means to have an internal telehealth champion?
It's really everything, and truly, and Misty can probably speak to that. She'd probably want to have more than one champion in her organization, junior champions. It really only because, and I preface that to say, we rolled our core application out in the middle of a pandemic when we could not bring our staff into the office to, make sure that they had their app appropriately loaded on their tablets and really kind of resolve any real-time issues if they were having connectivity issues or if they were having trouble navigating their tablet. And so naturally there may have been some delay in did you get your app loaded? Did you test it? And then maybe us troubleshooting that a couple of days behind. So we didn't be able to, troubleshoot that in real time. Had there not been a pandemic and they could all come in and do a live session, we could have resolved that in real time. With that, on the back side of that, I think, to be able to have those champions are phenomenal. What we are doing going forward is, as we're distributing new devices into our workforce, we're loading them, preloading them with the employee information to include the Cincy app already. So, I mean, we recognize fully that, just as they have their WellSky information and, Procure our other platforms that we have, Cincy is going to be one of those core applications that are going to be on it. We just believe in it so much. And so it's just so important that we have, along with the application, though, somebody or an internal resource that can help them to navigate their questions and to and be that support person for them.
Yeah, excellent. And I think you answered the follow-up that I was going to have there, which is having that internal resource that you can be reliant upon to answer the questions, to guide, to navigate. As you mentioned, it would be a whole different story had you just been able to have an in-service or two. That's the easy world. That's pre-COVID. But certainly with the things, changing as they have in 2020, having to be more creative about a virtual adoption has really been, again, that we've seen reliant upon a champion. And so to your point, again, kudos to you guys for taking that initiative and not just assuming that it's going to get adopted, but really driving the expectation and doing that on a daily basis. And I can tell you, just by way of conversions and metrics, because we love conversions and metrics and we report and everything, return to work, you guys have one of the highest adoptions across the network. And so I think it's important for the folks on the call here to hear and understand how you came about that. And it certainly wasn't a snap of the fingers. It does take work. And we are here to really kind of scratch the surface here on, saying, look, this is required from the top level down. And I think, Alicia, you and Misty have taken that to the next level and continue to be enthusiastic about the next level adoption with RPM. So
yeah.
fantastic.
And Misty and I were just talking about that last week, because I'm a leader. I like to create incentives just in general practice, but at the field level, Misty's sitting more on the administrative level corporately and kind of pushing this platform down. But from a field champion, once we get over this pandemic space, how do we identify these field champions and create field mentors of the Cincy platform and create incentives to help drive adoption of that as far as our new employee orientation process and monitor that, because I just feel like the more adoption that we have, it just trickles down. It trickles down to improved outcomes. It trickles down to reduced costs. And, the more comfortable that the staff are with using it, the more they're going to speak about it to their patients and to their caregivers, and the more they're going to be loading the apps with their patients on the very first visit or even prior to the first visit. And so it won't be an afterthought, it'll be a forethought. And so we just need to this needs to be the part of the introductory language as we do the consent. Cincy needs to be part of it, just as we were talking about patient rights and policies and procedures. We're talking about Cincy just as fluid as we are that other parts of the admission conversation.
Absolutely. Upon admission, patients know about Cincy. Upon new employee orientation, our employees know about Cincy. They know that they're not going to see patients unless they fill out their Cincy questionnaire for the return to work. They're very aware. Through our orientation process, we've been able to use Cincy for some visits that we needed another set of eyes on something for somebody for different situations, such as visualizing a wound maybe, or just sometimes patients need that face-to-face reinforcement from somebody. Just a phone call isn't enough. So we've used it in many ways. As much as our elderly population struggles with technology, it is so, it is the way of the future. And I think that, and they're understanding that more and more. So of course, resistance comes with change with our elderly, but we really have been able to show them, many of them, all the different ways that this can help us. So I'm with Alicia 100%. It starts with orientation. It starts with start of care to get that dialogue started so that they understand. We treat every patient, if they're going to use Cincy, one way or another. If it's going to be a remote visit, if it's going to be messaging that we send them, if it's going to be an email that we may send them, their caregivers being involved. Every one of our patients are touched or know about Cincy when they come on service, and whether we can use it right then with them, or if it's something that they heard about and we can reinforce it later. Again, we try every employee and every patient to be touched by Cincy in some way so that they can recognize and trust this information, and this is how it's used to support. Translation, just multiple different ways that you can use Cincy as a platform.
Yeah, and Misty, you bring up a great point in that really in time, the communication platform has to become a second nature, right? So to incorporate it and use it as part of your own healthcare process. And so in the delivery of your care at Excelin, I think what you're saying here, just to summarize a portion of that is in all aspects, whether it's new hires, whether it's existing patients or caregivers, it has become second nature. And the way you went about that is to drive adoption through all facets, up to and including new hires, to make it an expectation, not necessarily a request. And so with that, expectation, again, having that become second nature and recognizing the benefits and value of the virtual care, there's a lot to be said for that. And so for again, the folks listening on today, I do know it to be a big concern when adoption, is either stagnant in the beginning, but really what I'm hearing is, so as long as you push it and drive it in all aspects, that it is a multifaceted communication platform. There's a variety of creative ways to use it, and it sounds like you touched on 4 or 5 really different communication mechanisms.
Yes, sir. Correct.
Yeah. Yep. Fantastic. So in talking about just a little more, digging a little bit deeper on Cinzy, the platform itself, for those less familiar, obviously the emphasis in post-acute care, what we've been discussing today, and as Alicia said, your acute care partners as well are tied directly into that, because this is about transitions of care. This is about effectively taking the patient and delivering the care in the most appropriate and timely fashion. Which in this day and age, I mean, let's call this what it is here in the midst of a pandemic, it's virtual, right? And so you don't have that ability real time any longer, or with less patients, to whether it's a COVID positive patient or whether it's a patient in a geographically maybe rural area, spanning across both California and Texas. I know some of the things you guys have talked about is really being able to reach out across geographic barriers and no longer being bound geographically. So having said that, Misty, you had mentioned about, maybe some of the elderly patients and those who would otherwise, be less likely to adopt, a technology like this. I know that sometimes, we hear that technology can be a scary word, right? New is scary sometimes. And so part of that adoption, when I look here about the intuitive technology with simple interface, it's one thing to say it, but talk about the intuitiveness, if you could, just to give me an example about how it required even less training maybe than you thought, or how some have just kind of taken it on their own and been able to utilize a technology like this.
Well, one of the things that, I always believe, where there's a will, there's a way. And some of the situations that we've encountered where a patient is just terrified, they don't want anybody in their home, but they really need care, or their spouse may not be able to have somebody into the home. And the technology that you guys have rolled out even farther is that it's just a click of a button for them to be able to get into the system through that text messaging. Whereas before, where you actually had to download, the application to be able to use it. So it has become even easier for the patients to use. And again, when we're faced with these situations, people figure it out. It's very easy to use. Caregivers have stepped in to be able to assist. And we did struggle in the beginning to really make them understand why we needed it. But when push comes to shove and patients understand, they're more than willing to learn, so that they can get the care that they're needing. So y'all's newest interface to be able to, again, send the text message, then click on the button, is very much with other platforms that are out there that they're using in physicians' offices and such. So it's become very user-friendly for the patient to use.
Yeah, and thank you for bringing that up, Misty, because that really is, when I look here at driving patient engagement with multiple modality communications, what you're referencing is the click-to-call functionality. Correct. And that click-to-call functionality has truly been a game changer, and as far as the feedback that we've received, across the platform spectrum. Having said that, just a little bit more about click-to-call. Gives you the ability to send out a one-time message that is on demand and allows for a patient to simply click the hyperlink and initiate that virtual visit and that communication real time with said provider who initiated that request and that invitation. With that, it is no longer requiring the download of the application. So should it be a patient that is less, technologically proficient, we'll call it, or savvy, that is something that could be simple for anyone to use, simply because they're able to click the call, which is to click the hyperlink and initiate that, face-to-face conversation. So yeah, I think that I would agree is a game changer, was a game changer. And we thank you again, because that's feedback that was brought about from our client base. And so those are the types of things that we, as a partner, want to be closely tied, in an effort to really make it more efficient, as you mentioned, for those patients who are less technologically savvy. So I'm glad to hear you say that.
Well, and I'll tell you, Edward, and that sorry, I didn't mean to interrupt you, but that hyperlink really just made a big difference, because I call it our hook. Once we actually get to send that hyperlink out and the patient is engaged and uses that and sees how easy it is to use, then it's much easier to get them to be able to use the other features by then getting them to download the application and things like that. So this opened up a whole nother sector, because the first portion of it was a little difficult at times due to the patients not knowing what their iTunes passwords and things like that were. So this makes sure that everybody can utilize Cindy no matter what technology, as long as they have that ability to receive that text messaging, and be able to click on that link. So it really did open up the doors for a lot more use in our patients. But once they've actually used it and they're engaged with it, they really like to move forward and get the application where they can make those calls back and be able to call, their nurse on call or call their therapist or whatnot through the actual application.
Very interesting. So what you're saying is it was utilized almost as a segue to technology, right? So when there was less adoption, make it so user-friendly and simple that they can't go back. And like I facetiously say, it's once you see it, you can't unsee it. And
That's
hopefully
right.
You've heard some of that from your patient base.
That definitely
once you know it's
helped.
out there.
Yep, it definitely
That's right.
helped. So it definitely helped to move forward with them seeing the importance and how much it actually could provide to them. So definitely.
Yep. Yeah, I think once they recognize those benefits, going back to it being a scary thing sometimes with technology and the adoption of it, we hear it all the time. We try to do our best to break down the different communication barriers with something like a click to call for those who, have never been to an app store. And frankly, if I think about, somebody like even my mother in her late 70s, she's not necessarily going to have her username and password for the Apple store. I mean, let's call that what it is. I hardly remember sometimes. So that being said, the click to call really has changed the face of what it means to be intuitive and to be able to quickly and easily connect with that provider. And having said that, we have the ability, you mentioned something about, languages and translation there. We do have the ability with a partner organization as well to take that program content and inject the patient's primary language into the platform. And that way, every time they receive that automated touch point, it does go out in their preferred language. I do, I don't just want to breeze over that. I think that is another critical component. And really that's being the most patient-centric possible, which is to adjust and adapt to their primary language of choice, not necessarily always English or Spanish, right? So that being said, I do want to briefly just touch a little bit more on the communication platform, just to kind of peel back the layer so the folks on the call today can understand the different components of the communication platform. Of course, we have our virtual visits, which we just talked about. Those can be downloadable applications where you initiate, again, being bi-directional. So bi-directional simply being you guys can either reach out or your patient can initiate that as well, or that can be disabled to where it's a one-way communication on that on your clinician side. And then you also mentioned being able to internally send out assessments. And so with you guys, I know return to work has been, explosive in its adoption. to assess the staff for COVID-19 before returning to work or visiting a patient home. Talking about a zero infection rate. I mean, that you just don't hear those things without, the utilization of really a different type of technology, right? And sometimes, unfortunately, it's too late. And obviously we know that once it's spread, it's spread. So being able to, be extra cautious, I think, is something I definitely wanted to highlight there. And I'm glad you elaborated. And then, of course, you guys mentioned about secure messaging, which is both internally and to patients. Now, are you guys sending out any sort of other types of assessments aside for the return to work that you found to be beneficial for either staff or patients?
We've had several different types of assessments that we've been able to do. That when we call it survey, that survey questions we can do under that assessment. We've been able to figure out how many of our staff have already had their flu vaccines. We're very lucky and fortunate in some of our communities that they've already started the questionnaire from our health department about COVID vaccines and how many employees. So we've been able to use those assessment tools to be able to ask those appropriate questions and do that. We really are going to start working on the next movement in our CINSI, and that is some of the more assessments to get more robust in that area of different disease processes and things like that. We, as many things as we've adopted and done, that's really our next phase, is working in more assessments based on disease processes and being able to identify patients that need those specific assessments done more regularly. So that's a next project.
Next project. All right. I'm taking that down for Rolando as another phase, but
he knows.
Yeah, there you go. Well, it's our job to listen and to adapt and to strategize. So we appreciate it. So having said that, you did mention identifying those respective patients and, what it means to, have the ability to follow up and reinforce, to align directly with your acute care partners, as Alicia mentioned. And so with those acute care partners, again, you guys have very robust reporting as well throughout your EHR. And so having said that, looking at condition management here as the first picture there on the slide, one of the things that we're able to do really is, and that you guys have taken advantage of, is really get cohort specific as it comes to disease management and being able to take your diabetic patient or your patient with MI or CHF, or, especially those high, 20% of readmitters who we know CMS has already highlighted as well statistically, and be able to send out those automated touch points. And so by way of condition management, what are some of the ways that you see CINSI being utilized for condition management to not just have the patients identified, but to actively play a role in that condition management?
The first one that we did is for the COVID-19 patient. So when we scripted out our clinical management protocol for COVID-19, we incorporated the use of CINSI as part of that protocol. And so when we went to our acute care partners and talked to them about how do we assume care of the COVID-19 patient and adopt that patient from your acute care bed, in an effort to help clear those beds, we said, we want to be a good partner to you. We want to be able to assume those acute COVID-19 patients and care for those effectively. But in order to do so, we need to create some sort of adoption and commitment of those patients with that CINSI platform. So that was scripted into our protocol right from the beginning from that. And so we really were able to test out the adoption of that clinical care path with the COVID-19 patient.
Okay. All right. Fantastic. Which leads directly into, again, final tips and thoughts. When I want to leave enough time for questions here, but in final tips and thoughts, you mentioned as it directly aligned with the pandemic and how it is that you guys, had your first initial use cases really brought about directly as a result of the pandemic, and trying to jump out in front of, not just disease management but pandemic management, and which is obviously a staggering result that you came to with a zero infection rate. But you guys started out really early and were early adopters of that, and leveraging the technology to really combat some of these, again, unfortunate trends brought about by COVID. So having said that, if you can just kind of give, final tips and thoughts, I would just kind of tee that up by saying, the most critical changes that you think that we need to address, how technology has addressed that, and what you see, as you briefly mentioned earlier, moving forward with the continued adoption of a platform.
In regard to caring for our patients going forward, is that, Edward, is that how you want me to?
Yes, sorry.
Okay.
Yep.
So definitely, we need to be thinking about telehealth and care of the chronic care patient going forward. What's your most expensive patient population, and how can you incorporate telehealth into that patient model going forward? Is that your heart failure, your wound care patient? What does that look like for you in your space of business? And we internally are doing the same thing. If you were going to go to a shared risk model, or going into any of those payer groups or hospital preferred partnerships, those are going to be the same conversations that you're going to have with them. So if you're not going to be looking inward to your own practice, you're never going to be able to have that same conversation to an outward provider. And you need to be able to practice that. So, their question's going to be, do you have any type of technology that's going to help you to support that and to track and trend it? And you need to be able to lean on your own technology to be able to do that. And then, do you have a way of still servicing those patients? And do you, every one of them so far has asked us, do you have a telehealth platform? And so, we've been so proud to be able to say, yes, we have. The nice thing about that Cincy has, that not all of those telehealth platforms has, is the ability to connect the doctor directly with the patient at the same time that we're there, and multiple people at the same time. So let's just say that a patient calls me and I'm on the triage, and they're having some shortness of breath issues. It's a chronic care management patient, and they're in some sort of a agreement to try to keep the patient out of the hospital. We're all collectively working for the same goal. We're trying to keep the patient out of the hospital, right? So I'm going to get the doctor on the phone at the same time. We're going to try to do a collaborative visit with this patient, order some medication if we can, if it makes sense, and try to keep this patient out. We may call back to the patient in a few minutes to see if their symptoms are resolved before we make a decision to go send the patient to the hospital. Otherwise, that patient would have probably called 911. But the patient knowing that there's a nurse and or a doctor being able to virtually lay out on that patient gives them a lot of confidence that there's a clinical team managing that patient's care at home that knows what they're doing. So I just think that those types of actions, direct actions immediately, is going to be what we're going to need to be able to do. There's a lot of discussion right now about a sniff at home model in the future. So how do we transition this acute care patient from a hospital bed directly to home, and be able to take care of this higher acuity patient in a home setting? You have to be able to utilize some technology like a telehealth platform to lay eyes on those patients in between home health visits, and be able to manage that patient at a higher risk. So in order to take that higher risk, you have to use some sort of technology to support that care.
That's right. And balancing that between high touch versus high tech. And so you detailed that nicely. So thank you for that, Alicia. And so that is, leading directly into time is, of course, of the essence, the in-person care versus why the telehealth now. You've detailed that, beautifully, which is there is no better time really than yesterday to get ahead of this and jump out in front of it. And the efficiencies that you guys have found with the robust adoption that you have there at Excelin, really speaks volumes to any organization can do it. I think Misty was very candid in saying that, from day one, no, it wasn't just readily adopted, and it's not just going to be a snap of a finger and just happen. And I think Misty detailed, how you guys overcame that. some of the both internal struggles and with the patient as well, brought about, before click to call, and how we collectively, again, as a partner organization, collectively overcame those. So I am, super excited with what not just 2020 has looked like by way of the efficiencies that have been adopted at Excelin, but even more excited with what 2021 holds by way of increased adoption of different communications with condition management, as you've stated, with the SNF at home model that you've just detailed, Alicia, and how we can support that with the platform, as well as new to some, but very exciting nonetheless, with RPM and the way Misty has said that has been embraced, and that is going to continue to be expanded at Excelin across multiple regions. So why telehealth now? I think that we've covered that. Misty and Alicia, I think you've detailed exactly why, and hopefully the folks on the call here have benefited from hearing it first person. One thing to hear from us at Cincy, but another thing to hear from great partners like yourselves, who have both detailed the work that's put in and how you guys got to the point that you're at today. So congratulations for that. I know that the folks on this call have much appreciated. Thank you so much for your time. So
well, thank you, Edward. And I'm probably speaking for Misty, but should you have any follow-up questions after the session, feel free to share our contact information with anyone, and we'll be happy to answer any questions that they may have about the operation.
Absolutely.